In this video, I will be going over the protocols for assessing flexibility of your client. For all these protocols, ensure your clients remove their shoes. The first protocol we will go over is the YMCA sit and reach test. This test will assess hamstring flexibility. For this test, you will need a yardstick and a piece of tape about 12 inches long. Have your client warm up with moderate aerobic activity for at least 5 minutes. Place the 12-inch piece of tape over the yardstick at the 15-inch mark. Have your client sit on the mat with their feet about 10 to 12 inches apart, just above the tape line. Their feet need to be dorsiflexed with their heels flat on the floor at about a right angle to the tape. You want your client to have their hands overlapping and parallel to each other. This picture shows the correct placement of the hands, while this other picture is showing the hands not being parallel to each other. If your client starts leading with one hand, stop them and begin the trial again. Have your client inhale deeply and then exhale as they reach forward. Ensure their head is tucked between their arms. Make sure they do not hold their breath. With their hands overlapped and parallel and their knees flat on the floor, have them touch the ruler as they slowly reach forward as far as they can. No fast, jerky movements. Have them hold the position for 2 seconds and take the measurement in inches. Repeat this process twice and the best of the two scores will be recorded. My client's first score was 18 inches and her second score was 20 inches. We will be using the score of 20 inches. Based on the scores in the table, my client's measurements put her in the 80th percentile above average category. The second protocol I will go over is the chair sit and reach test. This test is performed on individuals who are 60 years and older to assess their hamstring flexibility on each leg individually. The equipment we will need for this test is a chair with a 17-inch seat height and a ruler. Place the chair against the wall to ensure stability. Have your client sit on the edge of the chair. They will perform 2 practice trials and then 2 test trials for each leg. The leg being measured will be extended forward with their heel flat on the floor and their foot dorsiflexed. Have the other leg bent at a right angle with their foot flat on the floor. Have your client position their hands parallel and overlapping, not leading. Their spine and head must be aligned and not tucked in as they slowly bend forward as far as possible, trying to touch their big toe. Hold this position for 2 seconds. Using a ruler, measure the difference from their big toe to the tip of their fingers. If the fingers touch the big toe, the score is 0. If they go past the big toe, the number is positive, and if they do not reach the big toe, the number is negative. Repeat this process for the opposite leg. For my client's right leg, her scores were 2 inches past and 3 inches past her big toe. Therefore, her score for her right leg was 3. And for her left leg, they were 0 and 1 inch before her big toe. Therefore, her score is 0 for her left leg. There is no classification needed for this test. The third protocol I will go over is the straight leg raise test, which assesses a client's flexibility of their hip extensor muscles while measuring the angle of their leg. In this test, you will only need a goniometer. Have your client lay on their back, ensuring they are completely flat on the floor. Have them raise one leg while keeping the other leg flat on the floor. Place the goniometer at the axis of the greater trochanter. Since this is a passive stretch test, have your client relax and have someone push the client's leg toward them to the point where they are comfortable and feel a pull. If you need to, you can hold down your client's other knee so it does not bend. Record the measurement and repeat this process for the other leg. 90 degrees and above is ideal. 80 degrees is acceptable and anything below 80 is unacceptable. My client reached an angle of 90 degrees for the left leg and 95 degrees for the right leg, both being ideal measurements. The final protocol I will go over is the Canadian front forward flexion test, or the standard sit and reach test, which will assess hamstring flexibility but on both legs at the same time. You will need a flexometer, shown here in the picture. Have your client warm up with moderate aerobic activity for at least 5 minutes. Have them sit on the floor with their feet against the box. Have your client inhale deeply and then exhale as they reach forward. Ensure their head is tucked between their arms. Make sure they do not hold their breath to create any fast, jerky movements. Keeping their fingers parallel and overlapped, keeping their knees flat on the floor, they will lean forward slowly as far as possible, holding that position for 2 seconds. Take the measurement in centimeters. Have your client attempt this process twice and take the better of the two. My client's scores were 34 centimeters and 36 centimeters. The best of the two was 36 centimeters. The box in this video is marked off at 23 centimeters, where the client places their feet. Some boxes are marked off at 26 centimeters. Based on the table, these values are set for a 26 centimeter box, so we need to subtract 3 centimeters from the values in the table to ensure the proper category. Since my client's score was 36 centimeters, I will subtract 3 centimeters from the values in this table, and her score will fall in between the very good category mark, because she is a 21-year-old female with a score of 36 centimeters. I hope this video was helpful in assessing flexibility for your client.